Riobamba, Ecuador, a regional capital located in the central part of the country. Momentarily considered home base for a group of Northwestern University medical students, here acting as one arm of the Global Health Initiative. Each day they depart by car and bus to the many neighboring towns of the Chimborazo province, working in clinics and visiting homes to bring healthcare services to the many distressed areas of Ecuador.
The majority of the people in Ecuador are either lower middle class or poor. So Ecuador is 14 million people. I would venture to say, let's take 7 million.
The community where I was at really it's extreme poverty, and it's the types of situations where people are living with their farm animals. A lot of times the animals are in the house, and part of our role is to educate them and let them know that it's not okay to have the animals in the house with you.
You do house visits to promote anti-parasite medicines, which are needed pretty much every 3 to 6 months for the people that live there because the water is unclean.
To buy a bottle of water is expensive, and to boil it requires energy, requires heat, and that's also expensive.
They haven't figured out exactly how to distribute the level of the quality of care from the top to the bottom yet. I think with Ecuador, it kind of just seems to be exacerbations of undertreated everyday issues.
We saw a patient yesterday who had a blood pressure of 210/92 and had never seen a doctor about her hypertension. With any sort of treatment, she probably would have gone straight to the emergency room, and here had been untreated and was just sent home with some drugs, because that's basically all that we can do.
The doctor and I have been frustrated that, today we don't have this antibiotic, or today we don't have this PPI for this person's gastritis, and we have to tell them to wait until we have it, or could you walk an hour from your house tomorrow to go to our other clinic which may have it.
An effort to relieve some of those supply shortages led to this year's partnership between the GHI and Project Cure that provided some of the students with suitcases full of medical goods to bring with them and distribute to nearby clinics in need of resources.
They packed the bag up for me, and I picked up the bag one day, took it straight to the airport. I brought it here, and I was able to deliver it to this clinic that I've been working at.
I see them using the supplies that I give them on a daily basis. Masks, bandages, some over-the-counter medicines. Gauze pads are pretty not rare, but they aren't as frequent here, at least in my clinic, as they are in the U.S., where we just sort of go to the stockpile room, open a gauze pad and put it on, put 5 or 6 of them on. But now that they have more of them, I think they're able to be more generous and give the patients actually supplies to go home so that they can change the dressings on their own.
I think that the medications here will actually help this clinic out a lot, and alleviates a significant financial burden for them as well.
With 45 million Spanish-speaking residents in the United States, all of whom will require some form of medical attention one day, the students have an excellent opportunity to learn the language from native speakers and the excellent teachers provided by the Cacha Medical Spanish Institute, a local GHI affiliate.
Ponga su codo izquierdo a la altura de su frente.
No entiendo. No puedo.
Pero podemos hacer el intento, ¿no?
Sí.
I came in with an introductory level. I'd learned some Spanish in high school, but hadn't used it much really, especially no medical Spanish. And I think my Spanish has significantly improved over the past few weeks, and I now think I'd feel comfortable talking to a patient, conducting an interview in Spanish, and I think that'll be very beneficial in the future residency and onward.
Los estudiantes en Cachamsi reciben un programa de inmersión en el que ellos están practicando durante las clases en la tarde el español médico en un enfoque clínico, pero su inmersión no termina solamente en la clase, sino que comienza cuando ellos van a sus casas.
Just being able to converse with a patient who's in need, who's stressed out because of a medical condition, they're in the hospital, this is probably the worst day of their life, just being able to communicate with them in their mother language is just so helpful.
Kachamsi may help the students become acclimated to the country and teach them about local culture. The most important experiences they will have are with their host families. Local residents who welcome the students into their homes, not as tourists, but as new members of the family.
Host family is probably one of the biggest highlights of the program. And my host family from day one, they gave me a room. Every single meal is provided for. They took me around the town on the very first day to show me everything there is to do in the town. I really do feel like I'm one of the family and very welcome in the house.
Getting to see a different culture. There are many things that are native to Ecuador that I haven't seen in the United States. For lunch, everyone takes off from work from around 12 to 3, and they all come back for a family lunch, which is really nice.
The lesson these aspiring medical professionals will take with them is about the vast potential they have to extend their influence outside the clinic, about their power not just to write prescriptions or tend to wounds, but to form life-saving connections with those under their care, healing not just individuals, but communities. Though they now depart from Riobamba, they're taking with them a deeper insight into their duty that as physicians, they have accepted a lifelong commitment to provide care, offer comfort, and improve lives.